Fact 61. Autoantibodies against acetylcholine receptors at neuromuscular junction, myasthenia gravis. For food botulism or Eaton-Lambert syndrome, there is decreased acetylcholine release from presynaptic terminal. Hallucinations, mydriasis, hyperthermia, tachycardia, anticholinergic toxicity. TCAs have anticholinergic effects. Goal in mechanical ventilation is to keep PaO2 55 to 80, oxygen saturation 88 to 95%, and FiO2 less than 60%. Amniotic fluid index normal is 5 to 25, less than 5 is oligohydramnios. Placenta previa risk factors: prior C section, prior placenta previa, multiple gestation, advanced maternal age. Bone fracture after a minor fall in female. Risk factor is osteoporosis. Preterm labor management. We give steroids for fetal lung maturity. For GBS, we give penicillin and we give indomethacin for less than 32 weeks and nifedipine for 32 to 36 weeks. Magnesium sulfate only in less than 32 weeks. Facet dislocation, C7 radiculopathy. It will present with decreased elbow extension, wrist flexion, and decreased sensation in index and middle fingers. Fall during skiing or MVA with dashboard injury leads to posterior dislocation of hip. Treatment: if it's without fracture, then closed reduction. If it's with fracture, then open reduction. Carpal tunnel syndrome not detected by Phelan ordinal signs. Do nerve conduction test. Bowing of legs is normal in a child less than 2 years of age. When do we say rickets? When it's in both upper and lower limbs, there is frontal bossing and other findings. Then it's rickets. When prescribing olanzapine, we do fasting, glucose, and lipids every 3 months because it may lead to hyperglycemia or hyperlipidemia. Infant with doll like face, round cheeks, hepatomegaly, hypoglycemia, hyperuricemia, hyperlipidemia. It's glucose 6 phosphatase deficiency. Body cannot break down glycogen. OCPs do not cause weight gain. Immune complex deposition in vessels, vasculitis, purpura, weakness, arthralgias. It's a triad, along with renal disease, confusion, decreased complement, and RA factor is positive. These together is mixed cryoglobulinemia, which is associated with Hep C, where increased AST and ALT are found. Beta blockers may decrease insulin sensitivity that may lead to weight gain and DM. In alcoholic liver disease, these all four are increased. AST is increased 2 times than ALT. Tourette syndrome treatment is tetrabenazine. It decreases dopamine. COPD leads to diaphragmatic flattening, which increases work of breathing. In carcinoid syndrome, there is increased production of serotonin from tryptophan. Therefore, there is decrease in niacin. Quick quiz. Autoantibodies against acetylcholine receptors at neuromuscular junction. Diagnosis: myasthenia gravis. Hallucinations, mydriasis, hyperthermia, tachycardia. Diagnosis: anticholinergic toxicity. Amniotic fluid index normal, 5 to 25. Placenta previa risk factors: prior C section, prior placenta previa, multiple gestation, advanced maternal age. Bone fracture after a minor fall in female risk factor: osteoporosis. Preterm labor management: corticosteroids, penicillin if GBS positive, tocolysis, with indomethacin if less than 32 weeks, nifedipine 32 to 36 weeks, magnesium sulfate less than 32 weeks only. Facet dislocation C6 to C7, radiculopathy C7. Fall during skiing, MVA with dashboard injury, posterior dislocation of hip. Carpal tunnel syndrome not detected by Phelan or Tinel signs. What do we do? Nerve conduction test. Bowing of legs, normal under 2 years of age. When prescribing olanzapine, do fasting glucose and lipids every 3 months. Doll-like face, round cheeks, hepatomegaly, hypoglycemia, hyperuricemia, hyperlipidemia. Glucose 6-phosphatase deficiency. OCPs do not cause weight gain. Purpura, weakness, arthralgias, renal disease, confusion, decreased complement, RA factor positive associated with Hep C, mixed cryoglobulinemia. Beta blockers effect on weight, decrease insulin sensitivity, weight gain, and DM. Alcoholic liver disease enzymes, AST, ALT, GGT, ferritin increased. AST is 2 times more increased than ALT. Tourette syndrome treatment, tetrabenazine. COPD effect on work of breathing, diaphragmatic flattening, increased work of breathing. Carcinoid syndrome effect on niacin, increased production of serotonin from tryptophan, so decreased niacin. The end. Thank you.